My disease is the Charcot-Marie Tooth disease. What is CMT and what causes CMT? CMT is a group of disorder that causes nerve damage throughout the body. There are many types of CMT. CMT is considered a mutation in the gene that makes protein involving structure and function in the peripheral nerve axon and or myelin sheath. CMT is more common, specifically CMT1A. CMT1A affects the PMP22 gene in chromosome 17. PMP22 duplicates, which, if CMT affects this gene, it tends to affect the PNS. And because PMP22 duplicate, it tends to affect CMT throughout axons. In this slide, there is an umbrella of CMT that are separated in subcategories: demyelinating, axonal, and intermediate. CMT is also hereditary, meaning they got it from their parents. If they are autosome dominant, they may only need one copy. If they are autosome recessive, they might need two copies. If they are X-linked, males may only need one copy, while females may only need two copies of the X chromosomes. 5 to 15% happens out of nowhere, meaning if the parents do not have any history of CMT and the kid end up having CMT, it is due to the mutation that just happens out of nowhere. Here are the different types of CMTs that I will go over. CMT1, which focus on the demyelinating neuropathy, which affects the myelin. The subtypes of CMT1 are CMT1A, which results from the duplicate of PMP22, and CMT1B, which is the mutation of myelin protein 0. CMT2 is an axonal neuropathy, meaning fear signals is being carried down the nerve. Abnormalities in the axon in the peripheral nerve cells. Mutation in the MFN2 gene are affected. The MFN2 gene help encode for mitofusin 2, which involve in the fusion of cellular mitochondria. In this slide, I am demonstrating a diagram that contains pictures of a demyelinating type and an axonal type. While demyelinating type affects the myelin, while the axonal type affects the axon. Here is the locus of issue in CMT. CMT is considered a typo in the mutation, and it tends to happen during the transcription to the RNA phase. It happens in most CMT types, like PMP22. When it duplicates, it tends to have a typo during the transcription to the RNA phase and contain CMT, or not contain, but it has CMT issues to it. Where CMT happen, PMP22 maintain myelin function. It is meant to keep the myelin healthy and alive. Swan cells is wrapped around the axon. Due to the mutation, swan cell is slowly being destroyed. In this image shows a really healthy swan cells wrapped around the axonal. As we look down here, this is what a normal myelin sheath should look like, while a damaged myelin sheath looks like. It looks like it is eating away the axon. When looking at the pathogenesis of CMT, here shows a diagram of the axon and the proteins where it goes. Gene products are assigned to neurons, axon or myelinating swan cells. Proteins are functioning their pathway as they are supposed to. Getting to see the bigger picture of an axon, I am going to focus on two common proteins, PMP22 and myelin protein 0. Both protein plays an important role in the Schwann cells. PMP22 promotes organization, play a role in maintaining cholesterol homeostasis in Schwann cells. They are located right here. When it is affected by CMT, it encodes 22-KDA glycoproteins, which are produced in the Schwann cells. It compromises 5% of the myelin protein. Looking at myelin protein 0, it is a major peripheral protein. It is important for the myelin formation and is the most abundant myelin protein for Schwann cells. When CMT affects myelin protein 0, in early stages there are an onset of weakness and sensory loss. When looking at the salutary conduction, we are looking at one healthy myelinated sheath or myelinated axon, and one which is considered demyelinating. So a healthy myelin will help action potential of one node of repair to another, while the myelin in the demyelinating axon is absent, which reduces the conduction, which leads to action potential failures. As shown in this histology of a myelin cell, these myelin cells are thicker, while the one on the right is demyelinating, which are thinner compared to the one on the left. Talking about the pregnancy and the outcomes of CMT. CMT is the most common inherited neurological disorder. It is estimated that 126,000 individuals are affected in the U.S. The U.S. population is 331.9 million people. 2.6 million people worldwide are affected by CMT. To remind you, 7.8 billion people live here on planet Earth. The outcome of CMT. CMT will progressively get worse, which will cause more motor and sensory issues. As seen from the chart, CMT1 is the most effective, while CMT2 is second effective. When looking at the signs and symptoms of CMT, patients may experience mild stumbling, walking, or even jumping. They might have a Pescava's feet, a gait disorder, claw toe, or an Achilles tendon retraction. A picture on the right top is a picture of a Pescava's feet. Patients who have a history of walking on their toes at a young age, feeling any numbness, or experiencing any hand and feet disorder. As we can see on the bottom right, a patient who is suffering from CMT, we are looking at his hands and his feet. They look very flexed. It really does harm the hands and feet. You can tell in picture C, his feet looks really flexed. It reduced their ability to feel heat, cold, or touch. Patient can experience nervous pain, muscle cramping, and they may experience muscular dystrophy. Again, in the patient, picture D, we see that there's barely any muscles on his leg. Patient may have an inverted champagne bottle leg. So as of right now, there is no cure to Charcot-Marie tooth disease, but physical and optional therapies are an option. Orthopedic surgery may help with disabling symptoms. People who suffer from CMT1A, they can take a treatment that stops the process of PMP PMP22 duplication or any PMP22 inhibitors. They can also go into genetic therapy.